Good afternoon, everyone. Thank you for joining us today for an important conversation on youth behavioral health. I'm Rhode Island's Health and Human Services Secretary, Wamazetta Jones, and I'm your host for today's virtual event. Some of you may have seen our Mental Health Action Month virtual event this May. We thought the time was right to follow that virtual event with a conversation focused on our youth and their needs. Today, we are going to talk to many experts in the field about some disturbing trends in our youth's behavioral health and what they and their organizations are doing to address these issues. We will also have some specific advice and resources to families and caregivers dealing with these challenges. I want to briefly remind everyone here with us today that when we talk about behavioral health, we're talking about both mental health and substance use. So behavioral health is both of those things and or but could be both. So recently my agency EOHHS completed and shared our comprehensive review of Rhode Island's behavioral health system. This review shows that there are some major inequities when it comes to youth behavioral health. So here's a few examples. Rhode Island's rate of students feeling sad or hopeless for at least 2 weeks at a time has increased by 30% over the last decade. Hispanic students report feeling sad or hopeless at rates higher than both students of other races and the state average itself. So our Hispanic students reported feeling hopeless 37%, and our state average is 32%. More than 40% of girls report feeling sad or hopeless every day for 2 or more weeks in the past year, which is 1.7 times higher than that of their boy peers. Lesbian, gay, bisexual youth self reported higher rates of sadness and hopelessness than their straight peers. Now, lesbian and bisexual girls at 66% report higher rates than gay and bisexual boys at 51%. And I know I'm throwing out a lot of numbers, and we'll have those for you in writing if you need, so you don't have to quickly try to write them all down. High school girls are between 1.5 times and 2 times as likely to consider suicide as their boy peers, but boys are more likely to complete suicide. Our multiracial students have higher rates of suicidal ideation and were found recently at 1.5 times more likely to consider suicide than their white peers. And one last example is recent Rhode Island Medicaid data shows that the diagnosis rates for white and non-Hispanic children are frequently double those for children identifying as Black, other, Asian, or Hispanic, meaning some of our most diverse youth do not get the treatment and services they need. Appropriate prevention and diagnosis and treatment of our children's behavioral health, and again, that's substance use and mental health. These issues must be done equitably across all age groups, behavioral health conditions, races, ethnicities, language spoken. But we need to be equitable. Has to be equitable. When I read these statistics about our youth, I truly changes. I was just really heartbroken. I knew it was bad, but I didn't know it was that horrible. And it's just not acceptable. As a mom, a lifelong social worker, the chair of our state's children's cabinet, and your secretary over Health and Human Services here in Rhode Island, I know for a fact that we have to continue to work together to help all of our children and young adults and prevent a behavioral health crisis from occurring. But we have to work together. We cannot do it on our own. We can't do it in our silos. We have to come together as a state to truly help our children. So let me get started with introducing our guests. Take a moment to briefly introduce each of them so they can join us. And I want to thank them so much for agreeing to be a part of this Facebook Live event today. First, you will hear from my friend and my colleague, Commissioner Infante Green, who serves as our Rhode Island's K through 12 education commissioner. Then you will hear from Heidi Driscoll, one of my colleagues in the field who represents our Rhode Island Regional Prevention Coalitions. Shortly after, you will get a chance to hear from Dr. Tammy Marie Phillip, who practices psychiatry for our children and adolescents at Butler Hospital. And lastly, but not least, Scott Sylvester, a licensed mental health counselor from Bradley Hospital. He brings to us 19 years of experience in behavioral health and crisis management. So he'll be with us today, and he is with us today. So I thank all of you all for agreeing to do this very important event, being a part of it. Again, can't just be one of us, it's all of us and then some. And so I thank you so much for being a part of this. So now, since we're having this conversation during the very first week of school for many of our Rhode Island youth, I want to acknowledge our great teachers, our parents who serve as impromptu teachers at home during this last year, and the also our emotional support staff within our schools. They continue to providing amazing support to our kids. Again, it's not just one category, multiple. It takes all of us, and every single person truly has had and have a very important role in this. So, with that said, I think it's very fitting to kick off our first question and answer discussion with the illustrious, the amazing Commissioner Infante Green.
Thank you, Secretary Jones. I have to say, I don't know what to say after that.
So my question to you would be, what are the behavioral health challenges you are seeing or that you're worried about among our children, our youth, our young adults? You know, for those of you out there who don't know, this woman right here, she truly is extraordinary and she cares so much. And I know we would just love to hear your thoughts, Commissioner.
Thank you, Secretary Jones. First, I'd like to start off by thanking you for putting this together and your vision for having us all work together, because we can't do it alone. So I am extremely grateful and for your partnership. But to answer your question, you know, as you were giving those numbers, it was heartbreaking, right? Like I could feel every number that you gave out kind of tug at the heartstrings, because we know this reality. We've seen a number of behavioral challenges for our students over the course of the pandemic, many of which stem from the isolation and anxiety, as you all know. We have been especially sensitive to the rise of suicidal ideations among our young people. The social emotional stability of in-person learning was deeply important for us. The students' mental health, the losing of the structure was very difficult on them. We heard from our kids. That's why we've prioritized in-person learning. So data drives the work that we do. Rhode administers a survey. It's called SurveyWorks. It's a climate survey given to students annually, to school staff and parents. We use students' descriptions of what they were feeling and struggling with over the last year, and along with the input from our School Health Advisory Council, to develop a guide to assist schools with the selection of universal screening tools for social and emotional behavior health. So much of our work this year has focused on addressing these issues at the root level. Earlier this year, Rhode worked with experts in academics, social emotional learning, and behavioral health to develop the Learning, Equity, and Accelerated Pathways Recommendation Task Force. That's what's going to drive our work this year. That group, in its efforts to support academic achievement and address root inequities in Rhode Island's education system, identified, you know, we're talking about academics, identified social emotional learning and behavioral health for students as two of the most crucial priorities. So some people might be saying, but what do they one have to do with the other? They are intertwined. This is important work for us. Further, we are in regular meetings with our Office of Rhode, DHS, BHDDH, DCYF, and HIC to support the development of a statewide system of behavioral health for youth to address the emerging behavioral health trends on youth suicide attempts and other mental health concerns. Concerns around youth suicide attempts, along with other mental health, is what we have been driving for back to school. We're also working to give our educators the resources they need to address mental health and behavioral issues, such as with our partnership with Yale to offer a free certificate course, Social Emotional Learning in Times of Uncertainty and Stress. Why this has been important? Research-based, what this program does is it gives research-based strategies and promoting mental health-based behavioral development courses in our local education agencies. To date, 34 of 30 school districts participated at least in one course. So that's exciting. And it's open to everyone that touches our students, from teachers, teachers' assistants, bus drivers, bus matrons, everyone that touches our students. Finally, we have secured funds to provide Signs of Suicide curriculum to all middle schools and high schools per the Nathan Bruno Act requirements. We are also able to support the expansion of evidence-based youth mental health first aid and teen mental health first aid statewide. So for us, it is essential to build the skills of adults working with students to support our youth and recognize mental health concerns as soon as possible. So we're here to partner and work, and we're going to make it happen for our students in Rhode Island.
Thank you so much, Commissioner. Just thank you so much for all that you're doing and what I know you're going to be doing. And what you were just sharing leads me to a question for Heidi. What challenges are you seeing as a prevention coalition and as a parent yourself? And what is your organization doing to address these challenges?
Well, thank you so much, Secretary Jones. My name is Heidi Driscoll. I am the director of the South County Regional Prevention Coalition. We are one of 7 regional prevention coalitions funded by the Rhode Island Behavioral Health, Developmental Disabilities, and Hospitals. Our mission is to prevent youth substance use and promote wellness across the lifespan. Each coalition is made up of community members from a variety of sectors, such as healthcare, schools, parents, law enforcement, youth, and local businesses. So as far as the challenges that you talk about, our youth are seeing a lot of challenges. Adolescence in itself is a challenging time. We have had the chance to speak to many community members and countless parents over the summer months. We were out at the Washington County Fair, the Seafood Festival, National Night Out, various backpack and school supply giveaways, and parents have told us how difficult the last year and a half has been for their kids. Adolescence is a time for kids to figure out who they are and who they want to become. They are consumed with social media, fitting in, and relationships. Now add in a global pandemic, and their entire world has changed. Isolation, anxiety, fear, just to name a few. It's not an easy time for our youth. Our kids are under so much stress, and they're in crisis often. Many of our young adolescents are also struggling with peer pressure, understanding their sexual identity and their sexuality and gender identity, and adapting to virtual environment and dealing with cyberbullies. In fact, according to the 2019 Youth Risk Behavior Survey, Rhode Island high school students who were bullied were more likely to have felt sad and hopeless for 2 or more weeks, avoided school at least one day in the past 30 days because they felt unsafe, and attempt suicide. Additionally, our LGBTQ plus population of high schoolers were most likely to report feelings of sadness and hopelessness. In Rhode Island, we just completed our Rhode Island student survey. We know from our 2020-2021 administration, Rhode Island youth grades 6 to 12, that 11.9% of our youth have ever considered attempting suicide. We know that alcohol and marijuana remain the most used substances by our youth. The 30-day use rate of alcohol for grades 9 through 12 is 16.7%. 30-day use of marijuana is 17.2%. Now compare that to our students who identify as bisexual, gay, or lesbian, and 30-day alcohol rate goes up to 20.7%, or 1 in 5. 30-day marijuana use moves up to 23.9%. That's almost 1 in 4 students. And those numbers are even higher for students who identify as transgender. I know the figures are startling, but the good news is that they are preventable. The regional prevention coalitions focus on risk and protective factors for adolescent substance use. The more risk factors a youth experience, the more likely they may be to use a substance. Many risk factors that have been heightened by the pandemic include family conflict, academic failure, lack of personal commitment to school, low neighborhood attachment, poverty, and household availability to substances and guns. Concurrently, the more protective factors that are in place, the less likely a youth is to try or to begin using substances. For example, family connections, positive parenting styles, a connection to school, participation in extracurricular activities, positive connection to other adults like coaches and teachers. All of these things will reduce the likelihood a youth will try to use substances. We work to increase the protective factors and decrease the risk factors in our youth so that we can delay or deter use as long as possible. In addition to this work, the regional coalitions under the Partnership for Success grants are working to remind adults of the importance of not allowing minors to use alcohol. We have recently launched a new campaign called Rhode Rules to highlight the social host law. The goals of this campaign are to educate audiences about the legal consequences of the Rhode Island social host law and to educate parents about the harmful effects of alcohol use on the developing adolescent brain. We're also working on a campaign called Keep Your Focus. It's a youth marijuana prevention campaign that is being launched over Twitch. Twitch is a media platform used by millions of youth, and this will highlight the risks of youth marijuana use. So those are some of the things that we're doing at the moment and working together as a team.
Thank you so much. That is quite a bit, but also know that we all say all the time, it's still not enough, or we have to get more creative and innovative. But wow, thank you. One of the things you mentioned here today, also, I'm glad you mentioned the unique needs of our LGBTQ plus youth. In fact, our behavioral health system review identified that almost 40% of bisexual students seriously considered suicide in the past year, which was 4 times the rate of straight students, and that Rhode Island has the most depression and gender sexuality related crises in New England. We have a whole lot more work to do, and some of our kids are indeed in crisis. And I definitely would love to pass this over to Dr. Phillips and Dr. Phillip and ask you this question. What are you seeing within your emergency services and inpatient stays and outpatient programs that is concerning to you?
And providing the platform, on which we can talk about these very serious issues that are affecting our communities in a very significant way. If I had to think about what we've been seeing, the only way I can describe it is that it's overwhelming. Pre-COVID, we had, kids, we had a lot of kids in crisis, but now the numbers are astronomical. We have kids on our inpatient units currently who are waiting a week and a half to get an adolescent inpatient bed. Pre-COVID, if you spent a night in the emergency room, that's probably as long as you would spend. Our partial hospital programs, which, we use a lot of the times to get in there in times of crisis to provide kids with extra support that they need so that their symptoms don't escalate to the point of needing an inpatient level of care. These programs now have very long wait lists, so we can't get to kids in the times that we need to provide them and their families with the supports that they need. On top of that, we have, we have the volume increases, but also the symptom burden has also significantly increased. So what we've been seeing is that we're seeing much sicker kids and families who are struggling in ways that we haven't seen before. They need a lot more support. They need more time on inpatient units and in partial hospital programs for stabilization, thus further stressing the system. And it all just points to our kids and our families are struggling with the COVID-19 pandemic. And, like Heidi was talking about, adolescence is a very difficult time at baseline, right? You're trying to figure out who you are, where you want to be, how do you fit into this world? And you couple that with what's going on, the social isolation, the financial stresses, kids are losing parents, kids are losing family members. And you put all that together and it's just created the situation where, it's been extremely overwhelming. Another thing that we've been seeing recently, which has been concerning, is the differences between our boys and girls. We're seeing a lot more girls on our inpatient units, in our emergency rooms, in our partial hospital programs, and we're not seeing our boys in the same way. And that's very concerning when you think about, the statistic that girls are more likely to experience suicidal ideation, but boys are more likely to complete suicide. So I think there needs to be a lot of work done to figure out how can we best support our, all our kids and families, but specifically, are there adjustments that need to be made so we can get to our boys where they need to, where they need help? Because the truth is they're struggling as well.
Secretary, you are muted. Sorry about that.
Is it better?
Yes, it is.
Okay, I'm fighting two microphones, and I don't know which one wins each time. Doctor, I was just, sharing, or stating that we do know within our Black and Brown communities, there's a significant stigma associated with mental health. And when you talk about then you add the fact of gender, boys, oh, you definitely cannot speak up about that. Oh, you can do, and we have to battle though. We got to get around those stigmas. We have to work harder and more fierce in truly eliminating those cultural taboos, as we once called them. Addressing these challenges in our youth definitely require us to think differently, redesign our systems to meet the unique needs of our children, and to come up with different approaches for our girls and our boys. But I also want to say we have to come up with better approaches on how to address the stigmas within the communities themselves. We got to get that. We have to have that going concurrently with everything else, or we'll never really overcome. So I know in my agency here at EOHHS, we're in the process of developing a children's behavioral health system of care plan. And I want to personally thank you for being our community co-chair for the prevention work group. Thank you so much. And I want to ask Scott too, what gaps and challenges are you seeing or hearing about from our partners and providers in the field when it comes to our kids and their mental health? What are you seeing?
Well, thank you, Secretary. What we're seeing is, with really a lot of what's happening out there with this youth is they're coming in, and when they're coming into our services in our emergency rooms, we're noticing, for example, back in between January and May of 21, we noticed that 80% of the youth that were coming into our services were there for behavioral health concerns. And as other folks were mentioning, not only the behavioral health concerns, but the intensity of the concerns that they're having and the behaviors and the intensity of the ideations and the suicidal thoughts is greater than it has been in the past, which is drawing greater concern to make sure that we're able to provide the resources for these youth and making sure that they're getting the services that they need. And on top of that, some of the aspects of some of the various symptoms that they're dealing with, they're reporting, anxiety, depression, social isolation, disengagement, and poor sleep, and then on top of other aspects of the typical development of the adolescent and going through the typical lifespan development there. So they're really struggling in all aspects, in the services and the amount of services that they're requiring. Let's face it, there's not enough of us to go around. We're doing the best we can to meet the needs that we can. But at the end of the day, when it comes down to it, we're trying to meet those needs. But there's a lot of kids out there, and a lot of kids that are requiring a lot of supports. And as much as we can, we'll meet the needs as possible. We're providing additional services as frequent as we can. But at the end of the day, there's a lot of kids out there that are really struggling, and we're doing the best we can to help them out.
Thank you, Scott. Let me see. Can you hear me? Okay, I feel like I need to check every time, like look between these mics. So thank you, Scott. I appreciate your perspective about the value of our mental health related visits here in Rhode Island. Experience has already shown us that these challenges increase for our youth in general every fall, but this truly highlights our need to do as much as we can together. But now, as we see our students get back to school and continue to work to stop, COVID-19. So every fall we see it, but then you lay what's happened with COVID on top of it and how we're trying to make our way through COVID. And, Commissioner Angelica, Infante Green trying to help us all understand the true need for us to have our children back in school and its impact. We have to continue to work together. But let's switch gears a bit. Let's now talk to our audience about what families, parents, teachers, adult mentors, and caregivers can do to help youth experiencing these, to help the youth who are experiencing these behavioral health challenges. So I'm going to go first to the commissioner and come back to you. And, Commissioner, you are so very right as it relates to, establishing a sense of routine and creating a sense of family cohesion, and how important that is, especially now. And I would like to add that equally as important is checking in with your kids. Perhaps, some people say daily. I say every other hour. I mean, I'm one of those want to talk to you all the time, parents. I'm overwhelming at moments. But you have to be willing and able to have those hard conversations about mental health with your kids in a way that they know that you too, you understand it and you don't have a phobia about it, that it's real. And oftentimes we find it challenging or maybe too taboo to ask our kids how they're doing socially, emotionally, mentally. But it doesn't have to be that way. If my child asks me, Mom, why are you asking me this? And you know what, say this, it's important that we ask everyone. It's not just about you. Just like I'm asking you, you can ask me. Let's talk about it. Everyone deserves to know that they have support of someone, whether it's just one bad day or many bad days. If you're not feeling yourself, or you just need to express yourself, a bit more. So, I mean, I want to pass it over, to Commissioner, and just what are your thoughts as it relates to this?
Yeah, thank you, Secretary Jones. You're 100% correct. And as we hear the number and the stigma in the families of color, I think it's something that we need to address. But now that we have our kids in person, many times the first line of defense is the school, right, against mental health issues, especially our educators who see the kids every day. So parents, touch base with the teachers, touch base. We have just updated our website, back to school site, with behavioral health supports for educators, for students and parents in multiple languages, because we want to get the resources out there. What we want to do at Rhode is give our communities the resources, the support they need to help the youths in their lives, or to recognize when to get them professional help. That's a skill and tools that we need to know when to do that. The most important thing that you can do as an adult is stay aware and check in with the young people in your life. That's really important. We know that according to the research, that having at least one supportive adult and a sense of belonging and connectedness are some of the most impactful protective factors that when it comes to mental wellness. So parents, one, all you need is one. Rhode is working with our districts and state community partners to ensure that every school has access to school-employed mental health professionals, including school psychologists, school social workers, school counselors who are trained and ready to support families, educators, and students accessing supports within the school setting and connect them to community partners and supports in the community. That's really important for us. This year in Providence, we made sure that every single elementary school had a guidance counselor that we never had before. We also want to create an environment where students feel comfortable sharing the difficult emotions they're dealing with. We heard from everyone here, adolescence is hard, but at all grades, kids are dealing with different emotions. And in a few weeks, Rhode is going to be launching a campaign, Let It Out. So if you see it, encourage everyone to let it out. It's supporting youth behavioral health. The campaign is encouraging our youth to recognize the emotions and just let it out. speaking, singing, dancing, drawing, a number of other health strategies to deal with stress. I know that my 11-year-old, TikTok is her venue. It also supports youth creating and reaching out to caring adults in schools. We want our students to have those caring adults in the system that they go to every day. We know that that is one of the most important protective factors. So we'll be offering other parent and community-oriented events over the school year. And if you have access to Facebook or Twitter, follow Rhode. We try to give as many resources as possible. And if it's something that we don't have that you want, we will try to get that. We want to work with you to make sure that our kids get what we need. And once again, thank you, Secretary Jones. This is very impactful.
Thank you so much, Commissioner. When you were talking about, just one person, you also reminded me of this. We were having some random conversation at some time, and we talk about, we also have to step up for each other. So, neighbors out there, if you're in church, people, where, if you can be a resource to a young person, if you could be a resource to that parent who's got to work 2 or 3 jobs and they're not able to be home as much as they would like because they have to work those jobs just to be able to cover so they can have a place to live and not have to stay in the car to keep the lights on. If you could just step up and ask their child, how are you doing? Touch base with them. Let's be there for one another to help each other and to keep saying, let it out, let it out. Let's all step up to help that young person, let it out. And by young person, we know, 3rd grade, 4th grade. It's not just 6th grade and 8th grade. And also I have to say, I know this is about, K through 12, but let's not forget those other young adults. I call my son a man child. He's 19, but, step up. It doesn't just stop there. They continue to have stressors and pressures. So Heidi, I know you're out there, you're in the community, you're talking to parents, and talk to us about what you share with parents, giving them advice on or ideas or techniques when you're out there in the community. Talk to us about, give everybody some ideas of what you share out there.
Yeah, thank you. And that's exactly what regional preventions do. In addition to what Commissioner said, in addition to being aware and a resource for youth, you also need to be educated. We as parents don't know as much as our kids know, trust me. So the regional coalitions really work to increase knowledge of substance, trends that are going on, mental health issues. So we do this by disseminating information such as quarterly newsletters, resource books. We run classes on mental health first aid, do things like strengthening families classes, which is an evidence-based class that runs about 12 weeks for parents. We educate not only parents, but we educate teachers, faculty, staff at schools, and community members about various trends. It's hard for people to stay up on everything. We provide alternative activities for youth to do to help keep them active and engaged. We know that a youth that has too much unstructured or unsupervised time on their hands are more likely to use substances. Another thing that we do is provide medication safety items to the community. We give out items to keep prescriptions safe and secured in homes and heighten awareness of how to get rid of prescription drugs in your homes. Recently, we were asked by the Department of Health to work on a campaign to raise awareness for young adolescents using over-the-counter medications. And so we took our existing campaign, Count It, Lock It, Drop It, and we kind of rebranded it and used it as an over-the-counter does not mean on the counter. So we're really trying to get the messaging out that things like ibuprofen, acetaminophen, and other commonly found household drugs are not as safe on the counter as they should be being locked up and being put and stored away. So the campaign includes print, social media, bus ads, radio ads on WPRO and Light 105. We have funding support from the Department of Behavioral Health, Developmental Disabilities, and Hospitals. All 7 regional coalitions are working together, also with the Department of Health, and we're giving away free lock bags to people. So you can go on to rhodeislandprevention.org/campaigns, and 2 ways to look. You can either see what community events that we're going to be at and go to one of those and get your free lock bag, or there's also a link to a drive that you can sign up and we will send you a free lock bag. So to date, we've distributed about 2,000 lock bags, and about 430 community members have requested bags on the drive. You know, it's not easy. We're asking people to change a behavior. I was a parent. I have older children now. I remember buying those large bottles of acetaminophen or Tylenol. It's cheaper. It's easier to purchase it, keep it on the counter. So what we really want people to do now is to still buy that large quantity, but take it and lock it up and keep a small amount on the counter so that your home is much safer for your youth. So the coalitions are giving these bags out free of charge. As I told you, there are 2 ways to get one. We'll talk about that again in a few minutes. But also, I think as parents, we also really need to learn about youth behavioral health and how we can also assist youth as they navigate the teen years, especially during COVID. Rhode Island Student Assistance Services offers training in QPR, which is question, persuade, and refer, which is an evidence-based training to all school districts and community organizations. And that offers information about the warning signs of suicide and how to refer a youth. So again, we need to educate ourselves. They also have a great YouTube channel that has many different mental health webinars on it for parents so that they can learn on all different subjects within mental health. So I think that's some of the things that we can do.
Well, thank you so much. It's fabulous to hear that so many of our parents are engaging in making their homes safe and preventing injury and harm from medications. And I'm going to tell you, the fact that you all they can get these bags and for free, it matters a lot because some folks can't afford it. They just can't. That's reality. That's the difference between buy that bag to keep the medicine out of reach, safe, my children safe, or have, a protein on the table tonight. That's real life. So just thank you all so much. And I also want to thank you and your colleagues for engaging my team at EOHHS every week, first thing in the morning, to address the summer safety needs of our children. That was really appreciated, and I look forward to a continuation of that. So now that we've talked a little bit about how to reestablish routines, check in with our kids, and make our homes safe, I would really love to hear more from Dr. Phillip. Dr. Phillip, what are some of the signs of change in our youth that we should be paying attention to as they might indicate distress and cause for concern? What are some of those signs? Because some parents don't really necessarily know and don't want to, they feel embarrassing and asking because they're not quite sure. Could you talk to us a little bit about that just this afternoon?
Yeah, of course. I think it's so important because we really want to think about how can we address this as soon as possible so that we can support our kids in the way that they need to, And I think communication is number one. I think even before the signs, like you discussed, communication is number one. I think I talk about I think people are tired of hearing me talk about communication, to be honest. But we have to make these conversations the norm, not the exception. And so that's what we encourage all the parents and families I work with. That's what we encourage. But I think it's also important that we as parents, as teachers, as community members, that we recognize signs in our kids. And I 100% agree. We can't do this alone. We have to have the village approach. Everyone has to be looking out for everybody. And there are 5 key things that you can sort of look out for as a parent, So one of the things that we look for is, are kids are they more withdrawn? Are they more isolated? isolated? Have they really pulled back from their family, from their friends? Are they spending more time in their room, not really engaging in activities and things that they did before? That's always a big red flag. You want to look for any big personality changes. You want to look for big changes in mood. So are kids more irritable? Are they more sad? Are they more anxious? Are you seeing a lot of changes in their mood? That's two other big red flags that we look for. Another big thing that we look for is, how are kids taking care of themselves? Are they showering? Are they brushing their teeth? Are they taking care of their hygiene? Are they engaging in more risky behaviors that they typically would not have before? We really want to pay attention to those things. And also, are they talking about feeling hopeless? Are they talking about feeling worthless? Are they, feeling very overwhelmed? We want to pay attention to those conversations that they're having. And if, your child or someone that is exhibiting any of those, you want to intervene. And how you do that is go to your pediatrician, say, hey, I've noticed that my child's a little bit more sad recently. They've been a little bit more irritable as well. They're not taking care of themselves in the same way. What do you think about this? How should we proceed? Talk to school. We all have to do this together, but our goal is to really, really intervene as soon as we can, so we prevent the progression from kids suffering more and needing much higher levels of care, which have become increasingly more difficult to access. You also want to think about, kids, unfortunately, in the time that we're living in, are spending significantly more time online. And we want to think about, what are they getting into? The cyberbullying that's happening, because now there are increased opportunities for this to happen. And kids aren't necessarily forthcoming about that. I think that's one of the hardest things for kids to admit, when there's a lot of bullying going on online, because they don't even know where it's coming from, who's doing it. And we as parents don't even know what's going on. So we definitely want to look out for those signs, because that could also indicate that something else is going on behind the scenes that we just don't know about.
Thank you so much for these reminders, and also pointing out how this might differ with the increase in the use of technology and social media. Some of which I'm not trying to tell my age, but that didn't exist. At the most, you had people maybe passing around notes in school about you, but I didn't live through cyberbullying and the social media part. So trying to understand it, and understand those signs, because we may not be on those accounts or seeing the bullying that they're going through. So thank you so much for bringing up that piece of, with the cyberbullying and technology. As you were also speaking, two other helpful hints for parents came to mind. I think one of the best things that families can do is to have a plan for what you would do if your child experienced a behavioral health care type crisis before it happens. Because when it happens, as a parent, as someone who loves them, you're going to freak out. And you're going to be trying to figure out numbers and who to call and what to do. So have a plan, be proactive, and hopefully you'll never need to use it. But if you do, you're ready to execute it right away. Have that plan and keep it updated, because numbers and programs do change. And also what signs to look for, which numbers to call, what information to give that you would need to give. But just have all of that together so you'll have it right at your fingertips to access and utilize to best help your child as quickly as you can. What might you need to put in that grab and go mental health kit that I hear you all reference so many different times. And I can tell you, my children are now, all three of them are in college, two in undergrad, one in grad, and I have my mental health kit. They're not children, but they are children for us. They need our help. And so just the other important things, to stay informed of, just that this has been really helpful. So I'm going to go to Scott, because I know, again, 19 plus years, Scott got in this work that he cares about and he loves so dearly. What resources are available to stay informed, to learn about mental health, and to get extra support? Because it's like those folks like you who are in it minute by minute every day. You all know where to point us to. What resources are available and how can we learn more?
That's a great point because all of us here we're all in it. We see this every day. We know what's going on. I think the biggest thing that any family member or parent, educator, anyone working with youth is really just to educate yourself. Know the warning signs as was mentioned, but also knowing the warning signs, knowing the protective factors, but also not to be afraid to ask questions and have that conversation, which is huge. Open up that dialogue, which is a big factor. And it was mentioned earlier, is that one invested adult. Let's face it, Rhode Island's not alone in this. This is a national trend that we're seeing amongst the mental health and the spike in mental health amongst youth, so it's really concerning. So what we've been doing over here at the Bradley Learning Exchange in Bradley Hospital, we've been reaching out to a lot of the local school districts. We've been providing training in the school districts. We've also been providing opportunities for parents and families to sign up for community-based trainings, mental health first aid, mental health 101, how to identify the warning signs, what signs to look for, how to support your child through any kind of crisis or whatever they're dealing with at that moment. In fact, we've actually partnered up with the Department of Health to provide 5 trainings specifically for the man on the street, moms, dads, parents, caregivers, aunts, uncles, significant others, whoever, shop clerks, whoever is out there, educators, on how to identify those who might be at risk for suicide using the Columbia Suicide Severity Rating Scale, which is a evidence-based tool, but it requires no advanced medical behavioral health training to administer. So we'll be providing that training on 5 different occasions. You can look it up. It's free of charge. People can sign up. You can sign up at the bradleyconference.org if they're interested. And what that is it's 6 simple questions you can ask to identify someone who may be at risk, but also what to do next, how to move them forward in the process, how to get them the supports and the services that they need in order to, move on with it within their life to get to a better place, and also to keep the family safe. Let's face it, these questions are hard to ask, so we provide them opportunity to practice with each other to really take some of the discomfort out of it. It's never going to get easy, and I could say from 19 years of experience, and I'm sure other people can say the same, it never really gets easy. But asking those questions can hopefully get that person on the right track, save a life in the end, but also open up those lines of communication, because if it's not at that point, maybe there's something else we can support them with. So again, you sign up for the trainings. They're free. We invite everyone. There's hopefully live. We'll see where COVID goes. But also there's a virtual options as well.
Thank you, Scott. I'm really glad to hear about the 45 minute mental health 101 training for parents, because as we all know, a full day of training is hard to participate in when you're maybe working, forget one job, but 2 jobs, or your second shift or third shift. You're also trying to put dinner on the table, help your kids with their homework, observe as much as you can. So 45 minutes might really be much, much more doable for quite a few people. And I'll include myself in that. 45 minutes you can pull off a little bit better and easier. So I like to end with one final, maybe quick answer question for all of us to answer. As we wrap up here today, let's talk to our listeners about how to get more information, become engaged, or reach out for assistance. If parents are struggling with mental health or substance use, I want them to know that there's a resource, for example, too, for them. Call 414-LINK, 414-LINK, to be connected to our behavioral health link serving um, entity for all Rhode Islanders. So 414-LINK. But to our panelists, what resources could you perhaps share, maybe Commissioner, in terms of speaking to students who are struggling?
Sure. So if you go on the Rhode website, we have front and center for everyone mental health supports and resources and tools. So please go on our website. We update it and it is in multiple languages, as well as please reach out to your child's teacher. Really important, really important. But we're here, we're partners, and I have to say, I learned something today. So I'm really excited.
Too, I was listening. I was trying to take notes because I'm like, oh wait, I didn't know that. And Heidi, for our LGBTQ and plus community, what resources or directionalities could you point them into, them toward?
Definitely. Well, I want them to know about the Trevor Project. So it's at thetrevorproject.org. They can also text START to 678-678. And also, as a reminder, they can also go on riprevention.org/campaigns and get the free medication safety lock bags.
Thank you. Thank you so much. And also know you can always bring some and we'll put them in some of the Health and Human Services departments and
We'd
we'll
love
have them for
to.
parents. Yep, Commissioner raised her hand too for schools. We could be on top of that as well for you all. Because we're in it together. And Dr. Phillip, could you maybe speak about maybe just in us with some more resources for families who are experiencing a medical emergency, such as an overdose or severe injury and stuff like that?
Yeah, for sure, if you any suspected suicide attempts, overdose, significant self-harm, please call 911 or get your child to the nearest emergency room for medical stabilization. There they can be stabilized and assessed and then go on to get the appropriate psychiatric care that they need, whether that be through Butler Hospital or through Bradley, but that medical stabilization piece is key. So please call 911 or get them to the nearest emergency room.
Thank you so much. And Scott, how about for families who have, experiencing children with mental health crisis, which Dr. Phillip also referenced just a moment ago?
For all our families who have a child experiencing a mental health crisis, I know it's never easy, but there is help. I want them to know that they can call Kids Link. It's 24/7 access at 1-855-543-5465 or 185 Kid Link to reach out. You can get a clinician and get the help that they need. But also, if they're interested in these free trainings, as far as the Bradley Conference, there, bradleyconference.org if they're interested.
Thank you so much, Scott. So, in closing, from a state perspective, I wanted to just definitely share we're making targeted investments in our youth from our Family Care Community Partnership, which works with DCYF, to our suicide prevention program at the Department of Health, and from our regional prevention coalitions in partnership with the Department of Behavioral Health, Developmental Disabilities and Hospitals, also called BHDDH, or people here called Buddha, to our early intervention services within the Medicaid program. We are committed to facing this issue head on. So it's stretched throughout all of Health and Human Services. And we just keep again looking at partner. And that's why everyone on this screen, I know we partner with, because guess what? We're not leading. We're a part of the partnership. We may be state, we may be government. I don't forget that. I know we talk about dollars and cents and government and getting and the money. However, we have to work as a partnership, with all stakeholders, definitely with the community, in order to get this work done right, to actually spend what little money we have in the best way to maximize the positive impacts for our family. So I want to thank each of you all who have been on this call today, each guest. I thank you for your very thoughtful, engaging, and insightful conversation with me today. I know for a fact I'm with Commissioner Fonte Green. I learned a few things and I just got me even more excited. And I thought I was up to speed. That shows how in a day or a week a difference can be made. I want to thank everybody who viewed this live event today for tuning in to learn more about this important issue, hear the advice from some experts. And even when I say experts, these are people who truly care. This is their life work. This is what they were put on this earth to do, and they stay in it and they don't give up no matter how hard it gets. But thank you for tuning in to hear from these experts. Um, and to help us spread the word to others who didn't tune in today. You can go back and share with them everything that you heard us cover and then some. So on that note, please share this link far and wide with families all across Rhode Island, and dare I say in other states, please, because Rhode Island is not unique in dealing with this very significant situation. Um, we encourage you to post this link on your social media pages and to help us get the message out so we can get help for more of our youth who are experiencing behavioral health challenges. Again, behavioral health is substance use as well as mental health. And to get those resources that are so badly needed in everyone's hands and support our community as a whole because all of us deserve it and we're entitled to it. So, with that, I want to thank you for joining us today. Thank our panelists. Thank all of the people who helped make all of this happen behind the scenes and encourage you to just keep staying positive and resilient and enjoy the rest of your day. Thank you.